All right, we're going to go ahead and get started so that we give Dr. Applebaum the full amount of time here. Thank you so much for coming to today's Animal Matters lecture series, which is presented by the Center for Animals and Public Policy and supported by the Lawrence Fund. So thanks so much, those of you joining us both in person and online. We are really thrilled to have Dr. Jenny Applebaum with us today to talk to us about her really interesting research looking at the role of pet ownership in shaping healthcare outcomes for individuals living with HIV. Dr. Applebaum is an assistant professor in the Department of Environmental and Global Health at the University of Florida's College of Public Health and Health Professions. She is trained as a medical sociologist with a background in animal sheltering, and Dr. Applebaum's research focuses broadly on the implications of social inequalities on human and companion animal health and well-being. Drawing from sociological theory and concepts to take a social approach to the One Health framework, her research is interested in the intersection of stress, structural level social processes, the social determinants of health, and the human-animal bond. So thank you so much to Jenny for joining us today.
Can you all hear me? Good. Okay. Thank you all so much for being here. Thanks, Dr. Mueller, for that introduction, and thanks for inviting me. So I'm really excited to chat with you all about my work on pet ownership and the human-animal bond among people with HIV. So I will just dive right in here. Okay. So quick disclaimer, I haven't necessarily seen people doing this, but I wanted to just, for ethical reasons, tell you that I did not create most of the images in this talk. I used AI for a lot of them, and so I assure you the talk itself was not AI generated. However, a lot of the images were, and if you're wondering when you'll know if it's an AI image, you'll know. This is I asked for a menacing cat saying you'll know. So most of the AI generated images look like this, but so in terms of what I'm going to talk about today, a little overview. So I'll give you a background on HIV and pet ownership, people with HIV and the human-animal bond. We'll talk about the Florida cohort, which is the data set that I used for all of the studies that I'm going to talk about today. Then I'll tell you about 4 different studies on pet ownership and the human-animal bond among people with HIV. I will synthesize everything, we'll talk about implications and then future directions, and there will be some time for a Q&A. So what does HIV look like in 2025? Most of you probably know this, but it's a chronic condition, right? Whereas once it was a terminal illness, we now have really amazing advances in treatment that allows people to live relatively normal lifespans if they contract HIV. And that's all thanks to antiretroviral therapy, or ART, which can achieve viral suppression. And when someone is virally suppressed, they are termed undetectable. And so that means that they basically the amount of virus in their blood is so low that on a blood test they're generally not, they look negative, right? And it makes it so that they have way less of the health implications of HIV, and they also are much less likely to transmit it to a partner. But strict adherence to ART and regular medical care is essential for this to be possible. So there's an enormous amount of medical care that people with HIV need to engage in on a regular basis. And so what does that look like? So viral load and CD4 assessments are required every 3 to 6 months, basically from diagnosis until death. And, you need to make sure that you are maintaining your viral suppression, and so you have to engage in that every 3 to 6 months. Additional screenings for STDs, other infections and cancers, which are more common among people with HIV. So those, therefore, you have to engage with the medical system for that as well. And then for people with HIV who are aging, and by the way, where I'm seeing people with HIV, you will see this PWH. It's much easier than writing people with HIV over and over again. For those who are aging, There are the typical age-related comorbidities that folks would need to engage with the medical system in order to address, as well as the long-term effects of just having HIV, and as well as the long-term effects of being on ART for however long the folks have been on it, because there are some medical health implications of long-term antiretroviral use. And then as you age, if you're a person with HIV, you will need to engage additional specialists that folks who are aging without HIV often will also have to engage, but not as frequently as those with HIV, including cardiology, neurology, nephrology, et cetera. And of course, there are structural barriers and disparities in HIV that need to be mentioned, right? And so adherence and healthcare access are challenging for those facing structural barriers, which is something that we all know, right? Inequality in healthcare access in HIV prevention is stark, right? There are a lot of issues with access to care and prevention that are affecting those who are on the lower SES spectrum, who are Black or Latinx, tend to have those health disparities that are exacerbated by HIV. Social stigma, while HIV is not as stigmatized as it once was, it still is a stigmatized disease, and that can impact people's access to care, as well as their quality of care, and stigma can even show up in healthcare settings, right? And then people with HIV in the US are disproportionately from marginalized backgrounds as well. So they tend to be disproportionately low income, sexual and gender minority, Black and or Latinx. And there are also disparities in new HIV diagnoses where Black and Latinx Americans have disproportionately high rates of new diagnoses. And apologies, that is my baby. So if you hear a baby crying, it's mine. She's very sweet, but she's never been to a talk before. She doesn't really know the etiquette. Okay, so let's talk now about pet ownership and the human-animal bond among people with HIV. So I put these two book covers on here because there are at least two books that I know of that are specifically about pet ownership and the human-animal bond among people with HIV. That's how salient this is for this population. It is, so important to this population often. Sorry, I'm just keep hearing my baby. So some of the specifics are they tend to, a bond with a pet tends to be a really amazing motivator for staying healthy, right, in this population. And so folks want to maintain their health in order to care for their animals. It helps them adhere to treatment and healthy routines like, dog walking, keeping a healthy diet, those kind of things. There's, of course, enormous emotional and social support provided by pets for people with HIV. So obviously that non-judgmental emotional support and companionship is really, really important for this population. They can buffer against social isolation and stigma, which there is like an epidemic of social isolation among people with HIV. It's exacerbated by aging, which a lot of people with HIV are now aging. And there's, of course, as I mentioned, stigma. And so relationships with pets can kind of provide some of that support where maybe they're not getting that human support. Sense of unconditional love, this one's really self-explanatory. I'm sure I don't have to convince anyone here. And then pet caretaking can provide a meaningful social role, which can reduce stress. So it gives folks something to do. It gives them, their role is to be a pet caretaker, right? And then it can promote effective self-management of HIV, basically by providing all of these things. And then there's also motivation and resilience. So a bond with a pet can be a reason to carry on during challenges for this population, as well as purpose and responsibility. There are, of course, risks of pet ownership for people with HIV, and some of these are more broad into pet ownership in general for everyone, but especially salient for folks who are, maybe low income, like people with HIV tend to disproportionately be, and so there's financial strain, right? So costs for pet food, vet care, medications can compete for resources needed for healthcare appointments, ART medications, those kind of things for people with HIV. Pet inclusive housing, I have a whole other line of research on this. It is there's really bad disparities in who gets access to pet inclusive housing, how much it costs, the quality, the locations, all of those kind of things are are really salient for folks with HIV. And then there can be a caregiving burden, right? So the time and energy required for pet care may add stress for people managing a chronic illness. It can interfere with attending medical appointments, which I'm going to talk about a lot when I talk about the studies. And then I won't be talking about this, but I thought it was important to mention that there is zoonotic concerns. So, you know, folks who are immunocompromised are more at risk for things like toxoplasmosis or giardia, things you can get from your pets when their veterinary care is maybe not properly maintained, or for cats, you know, so many cats have toxoplasmosis and we don't even know, right? And so that is something certainly for folks who are not, don't have managed HIV and are not on regular ART, it can become an issue. Okay, so the general thrust of this talk is that pets are rarely considered in HIV care frameworks despite strong human-animal bonds and potential healthcare implications. And so this is kind of what I'm gonna convince you of, that it's worth thinking about pets when we're thinking about HIV care, which I imagine in this audience it's not gonna be that hard, but in general. Okay. So let's talk about the Florida cohort. This is an ongoing survey study of people with HIV in Florida run by the Southern HIV and Alcohol Research Consortium, which is I'm so sorry, that was very distracting. At the University of Florida, where I am faculty. And so it's a statewide observational study of people with HIV in Florida. If you are someone with HIV in Florida, you are eligible for this study. The purpose is to examine social determinants, behavioral factors, and health outcomes associated with HIV and living in Florida. And then, so in terms of the scope, there have been approximately 3,000 participants since 2014 across 4 cross-sectional waves, and they do kind of short-term longitudinal, like 6-month follow-up, but it's generally cross-sectional. And so the work that I'm going to be talking about is from wave 3, which was the 751 participants. Pet ownership was 43% in this among these participants. And then in terms of the data collected, there are clinical outcomes, including viral load, ART adherence, also like care engagement, those kind of things. Psychosocial measures, including mental health and stigma. Social determinants like housing and food security, and then the PET module. So this was a really amazing thing that I had the opportunity to do. I got a pilot grant from SHARC, from Southern HIV and Alcohol Research Consortium, and we created this PET module. It was, my co-PI was Dr. Shelby McDonald at Colorado State, and we basically got to create our own little survey module that we appended to the Florida cohort, and anyone who said, yes, I'm a pet owner, was eligible to complete it, and we got 221 participants. This was collected from 2021 to 2023. Okay, so the objectives of the studies that I'm going to now tell you about are to identify the prevalence and predictors of pet-related barriers to healthcare access among people with HIV, examine relationships between pet ownership and durable HIV viral suppression. And when I say durable HIV viral suppression, that means like sustained viral suppression. So, you know, at those follow-ups, the 3 to 6 month checks, they're always virally suppressed. That's what that means. Investigate how unmet pet needs relate to mental health outcomes among people with HIV, and then determine whether access to pet-related services would be helpful for improving health outcomes among people with HIV. So the first one I'm going to talk about is pet-related barriers to healthcare, and that's that objective 1, identify the prevalence and predictors of pet-related barriers to healthcare access among people with HIV. So our hypotheses for this were that pet-owning people with HIV will report both past experiences and future expectations of pet-related barriers to accessing healthcare. Comfort from pets, income, and social support will be associated with the extent to which people with HIV report pet-related barriers to healthcare. And so I'm just going to really briefly tell you about this index that we used for this study, which we then went on to publish a validation paper of it in Anthrozoos. But this is the index that we created and we used in order to measure these pet-related barriers to healthcare. So these items 1 through 6 are these experience barriers. So it's, have you ever delayed seeking services? Have you ever not received services? Have you ever left inpatient services? And it's related to whether you're worried about your pets or you couldn't take care of your pets. And then 7 through 10 are these kind of hypothetical items of would you ever? So it's like anticipated or hypothetical, meaning, you know, would you delay services or would you miss services because of your pet? Okay, so our results here, 36% of the participants endorsed at least one of these items. So, you know, that's out of the 221. So 17% endorsed at least one of the experience barriers items, so the have you, and 31% endorsed at least one anticipated barriers item. So this is the distribution of the responses for those 10 items. And as you can see, you know, unsurprisingly, those anticipated barriers or the hypothetical barriers are more frequently endorsed than the actually experienced barriers. But we had, you know, 12% or so each saying they had delayed care. Then we have like 5 to 6, 7% of those who have forgone care or left against medical advice or AMA. So then when we look at comfort from companion animals scale in blue and a social support scale in orange, on the y-axis is the predicted number of barriers, so that's 0 to 10, and then on the x-axis in the blue is the comfort from companion animals, so it's like emotional support from pets, and in the orange is social support. So as you can see, as folks report more emotional comfort from their pets, the predicted number of barriers increases slightly, and then as social support increases, the number of barriers decreases, and that makes conceptual sense, right? So folks who have more social support are less likely to experience these barriers. They can seek care even if they are concerned about their pets, or you know, they are less likely to not have someone to take care of their pet, right? And then emotional comfort, essentially, is that prioritization. Like, do I take care of my pet, who I'm very strongly bonded to, or do I prioritize my own health, kind of thing? And so, unsurprisingly, those with a stronger bond were more likely to prioritize their pet, right? So then, if we look at these, when we divide by the previously experienced or the have you items, and then the anticipated items. So in the previously experienced or have you items, you can see that social support predicted that they were less likely, unsurprisingly, to have experienced these barriers, and that was significant. Comfort from companion animals was not quite significant, but it is associated with lower likelihood. And then income gets a little wonky here. I don't really know what to make of this, because it's basically saying that those with more income are more likely, and you can see the confidence intervals are huge, and I think it's probably because this is a relatively low income sample overall. We're not seeing a huge amount of folks who are really high income, and but this requires some follow-up to kind of understand what's going on here. And then we had here in the anticipated barriers, you can see that social support is less likely, comfort from companion animals is more likely, and then in the income, it also is a little strange as well, but we did hope to understand what was going on with income, and we didn't. We did not find out. So in summary, about 1/3 of people with HIV report pet-related barriers to healthcare. More social support equals less barriers. So the more social support from humans, the less pet-related barriers to healthcare. More comfort for pets equals more barriers. So more strongly bonded to a pet, more likely to experience or anticipate barriers. And then income is a kind of a question mark and requires further research. This paper was published in PLOS One in 2023, if you're interested. That's the paper. Okay, so why does this matter? And I asked AI to give me a skeptical dog professor. I was kind of channeling the director of the SHARC, the Southern HIV and Alcohol Research Consortium, who is not like a vet or HAI person, and because he's always like, but okay, they're experiencing these barriers because of their pet, but like, why does that matter? If we're not seeing this impacting actual outcomes, like, why does it matter? And so I was like, I will show you why it matters. Although he would never wear a suit, so, but otherwise it kind of looks like Bob. But okay, so pet ownership and viral suppression. Objective 2 was to examine relationships between pet ownership and durable HIV viral suppression. Our hypotheses were that pet owners will be more likely than non-owners to maintain viral suppression over the study period. Among pet owners, those who report any experienced and or anticipated pet-related barriers to healthcare will be less likely to maintain viral suppression than those who report none. Among pet owners, a higher degree of emotional comfort derived from pets will be associated with a greater likelihood of maintaining viral suppression. Okay, so, well, AI apparently has put a typo in there, but are pet owners more likely than non-owners to maintain viral suppression? It's supposed to say likely. So what we found is yes, if you count marginal significance. And so in our bivariate models, and this is showing with all of our covariates, but in our bivariate models, yes, we did see a significant relationship between pet ownership and viral suppression. But for those of you who are familiar with HAI research, that is not that exciting, because we do find all the time that pet ownership is associated with better health outcomes, right? But it's when we start putting our covariates in here that are related to both pet ownership and our outcome of interest, in this case, durable viral suppression, that things start to get interesting, and we're like, maybe there is like this, quote unquote pet effect, right? And so we found that there was a marginal significance between being a pet owner and having better durable viral suppression, above and beyond all of these social determinants, the sociodemographic characteristics, as well as, well, yeah, these are sociodemographic characteristics in this one. And so then we are wondering, kind of, let's break it down a little bit more, and among the pet owners, how are pet-related barriers to healthcare related to viral suppression? And so these are the first one I'm going to show you is these experience barriers, so the have you items. And we found that above and beyond sociodemographic characteristics, as well as we put in some standard barriers to healthcare that folks would consider, like time it takes to get to the doctor, how many times people were hospitalized, whether they had medical care in the past 12 months, and also social support. And we found that folks who experience pet-related barriers to healthcare, those have you items, are less likely to have durable viral suppression. So that's a really important finding, right? So, this it has a lot of implications that I'm going to talk about in a bit, but I frankly was really excited when this came out in the model. So, and then in terms of those anticipated barriers, no significant relationship. And that's kind of not surprising when you think about it, because it's not people who have actually said, like, I have not gone to medical care because of my pet. It's the people who said, like, I would not go if my pet needed XYZ. And then how is comfort from pets related to viral suppression? We would think that folks generally with more comfort, who derive more comfort from their pets, are getting that emotional comfort from their pets, and therefore their viral suppression is better, right? No relationship. There was nothing here. This, depending on which HAI papers you're reading, this may not be surprising to you, but essentially there wasn't really a relationship between comfort from pets and viral suppression, and that could be attributed to, like, there were a lot of folks who kind of just maxed out on the scale. They all said, like, we're very, very attached to our pets, we get a ton of comfort. So when you don't have a lot of variability in the scale among the participants, sometimes it is showing what you wouldn't see in other samples, but again, needs some follow-up. This paper is currently in press, so it'll be in AIDS and Behavior sometime soon. So if you're interested, FYI. Okay, so what we know so far, about 1/3 of people with HIV experience pet-related barriers to their own healthcare. Pet owners tend to have better durable viral suppression than non-owners, but pet-related barriers to healthcare are associated with poorer viral suppression. So now we have skeptical cat professor saying, what about other unmet pet needs? So let's talk about mental health and unmet pet needs. This is objective 3, investigate how unmet pet needs relate to mental health outcomes among people with HIV. Our hypothesis was that unmet pet needs will be associated with poor mental health among people with HIV. And just a shout out that this study in particular is being supported by a subaward from NIMH through the Center for HIV and Research in Mental Health from University of Miami. So thank you to them for supporting this. So in terms of the unmet pet needs that we were measuring, so we asked folks, can you provide all the necessary care your pet needs? So that's a really broad general one. Can you afford pet boarding if you need it? Do you have trouble affording pet food, medications, and supplies? And do you have trouble affording regular veterinary care? And so in terms of that first item, 9%, not a whole lot, but 9% said they cannot provide all the necessary care their pet needs. Those who said they cannot afford pet boarding was 37%. Those who had trouble affording pet food, medications, and supplies was 33%. And those who had trouble affording regular veterinary care was 20%. So how is this related to mental health? So when we look at unmet pet needs and depression, we can see that, and these are betas for linear regression that are plotted, but for those who can't provide all the necessary pet care, there was not a significant relationship with depression. And the depression, I should say, we measured using the PHQ-8. And so for those, however, who couldn't afford boarding, who had trouble affording food, medication, and supplies, and had trouble affording veterinary care, they all had poorer mental health. They had worse depression. Their depression was higher, and these models were adjusted for income, education, race, Latinx ethnicity, gender, age, and unstable housing status, which are all, variables that are associated with having unmet pet needs as well as mental health. And then when we look at anxiety, we see kind of the same pattern, where trouble affording veterinary care is really kind of a standout one, as really kind of a salient issue that is highly related to anxiety and depression. And so this paper is in preparation. My lovely graduate student is writing it, Selena, and so you can look out for that when we someday submit it somewhere. Soon, it'll be out soon. Okay, so what we know so far, part 2, we went through the 1/3 of people with HIV experience pet-related barriers to their own healthcare. Pet owners tend to have better durable viral suppression than non-owners, but pet-related healthcare barriers are associated with poorer viral suppression. There's a high prevalence of unmet pet needs, 9 to 37%, so that 37% is on the higher end for unmet needs. And then unmet pet needs are strongly associated with poor mental health. So now we have Bird Professor asking us, what about care engagement and HIV outcomes? So now on to the 4th study, which we're looking at pet services and HIV care engagement. So the objective for this one is to determine whether access to pet-related services is helpful for improving healthcare engagement among people with HIV. Our hypotheses were that most pet-owning people with HIV will believe that access to pet-related services would support their healthcare engagement. The need for pet-related services will be associated with poorer HIV outcomes. So we asked folks, would free pet food better enable you to access health services? 59% said yes. Would free veterinary care better enable you to access health services? 75% said yes. Would free pet boarding or foster support better enable you to access your health services? And 68% said yes. So these are pretty high percentages, right? Folks are not going to say no to free services in general. However, this was asking specifically, is this going to help your care engagement? And a lot of folks endorsed this. And overall, most participants, 79%, endorsed at least one of those, so felt that free pet-related services would improve their own care engagement. So then when we look at this with clinical outcomes, so this is missed HIV visits. It's at least one missed visit in the last 30 days. For those who had missed visits, which is in the orange, they tended to be more likely to endorse each of these needs. And we only have marginal significance on the pet food one, but overall the frequencies were higher than those who had no missed visits. So they needed pet food, vet care, and pet boarding for better care engagement. Missed ART doses, so again, that really, really important medication that keeps them virally suppressed. This was significant across the board, so pet food especially coming up is really important. Folks who had missed their ART in orange, and this was at least one missed dose in the past 7 days, I believe. Those who had missed it were more likely to need pet food, vet care, and pet boarding to support their care engagement. And then viral non-suppression, really important. Are they durably virally suppressed over, this is a 12-month period. And so for those who were non-suppressed, they had a higher need for all of these services as well. And it was significant for pet food. So pet food seems to be coming up again and again as this really important need. So if we reflect back on the previous study, it was veterinary care. For this one, it's pet food. And these are among the same participants. So there tend to be a lot of kind of co-occurring needs. So, bird professor number 2, he's a little more casual this time. What else might be helpful? So we asked an open-ended question, and 67 participants responded, giving us other desired services that might support their care engagement. And so one was pet-friendly housing, not surprising to me, probably not surprising to most of you. Another one was grooming services that came up as a theme. So one person said their nails get long and they need bathing. So this is kind of an overlooked need often, but it is something that these folks were saying they do need. Pet training and behavioral support. One person said the cost of service animal training is so high that it has not been something that I have done, even though I would qualify for a service animal, right? So that's just inaccessible to them for financial reasons. Pet medications. One person said the cost in flea and tick management. Again, that cost issue with being able to access their just monthly flea and tick prevention. Pet insurance. So I worry I won't have enough money for a veterinary emergency. So that was something that that came up repeatedly. And then emergency pet care. So a way to keep her safe if I couldn't care for her. So these folks are thinking about emergencies or unavailability for whatever reason that they need, essentially a safety net, right? Okay, and so this also is in preparation, and this is Selena, my PhD student, presenting this at the American Public Health Association conference. Thank you to Dr. Mueller for stopping by that talk, really appreciate it. I was not able to go, but so moving on to our synthesis portion of the talk, major takeaways. Pet ownership is common among people with HIV, so I didn't really talk about this a whole lot, but in this sample it was 43% of people with HIV. Certainly not a representative sample, but this is our best guess of the prevalence, and it's a little bit lower than the general population of US estimates that also varies a ton, but we're thinking is probably around 60%, but it's not surprising that it's a little bit lower among people with HIV, just given the sociodemographic characteristics that are overly represented among people with HIV. Anyway, a little bit of a tangent there, but this is kind of another one of my interests, is like how many people own pets. Anyway, it is common among people with HIV and may support viral suppression, right? We're still like kind of trying to figure that out, but there is indication that it looks like pet owners tend to be more likely to be virally suppressed, even above and beyond a lot of other factors. Unmet pet needs are linked to poorer HIV and mental health outcomes. So that was the clinical outcomes like care engagement, ART adherence, as well as viral non-suppression. And then we looked at anxiety and depression. They were all associated with these unmet needs. Comfort from pets is not enough alone, right? It likely, when you think back to the kind of review or the background that I gave all of you, there is a really important emotional bond between people with HIV and pets, at least those who are represented in the studies that we reviewed. but it's not enough to, give a person a pet is not going to automatically make them have better health outcomes, right? It might support them in some ways, but we need structural supports. We need things that support care engagement, housing, et cetera. Okay, so policy and practice implications here. This is a really obvious one. Integrate pet services into HIV care. So this is something like mobile veterinary care pet food banks. I mean, it's easier said than done. Everybody talks about this. I talk about it at every talk, but it's actually really hard to kind of coordinate all of that with these interprofessional kind of collaborations. But there are a lot of opportunities at universities, right, and in communities. Partner with animal welfare organizations. This is another one. There are HIV care providers as well as departments of health who see lower income folks and tend to see a lot of folks with HIV. Maybe having a partnership with their local animal shelters that can provide some kind of support for their pets might be helpful. And then consider pet inclusive housing and emergency boarding programs, right? So we need that safety net again, and we also need better access to pet inclusive housing, which is like really, really heavy on the policy side is the pet inclusive housing stuff that's going on. We need less pet fees on housing. We need less restrictions on housing. We need better accessibility, all in general, not just financial, but location, et cetera, in terms of pet inclusive housing. And then, yeah, that emergency boarding is really important for folks who maybe need to seek substance use treatment or like an inpatient mental health care, any inpatient surgery, having to stay in the hospital for a little while. We need some way to support that human animal bond so they have a pet to come home to and they don't have to resort to something horrible like having to relinquish their animal or something like that, right? A really good example of this is the One Health Clinic this one's in Seattle, and it's associated with Washington University or University of Washington in Seattle, and this one is for unhoused emerging adults and their pets. So they have a clinic, I believe it happens once or twice a month, where they bring together all these professionals that they provide veterinary care, I think dental care, basic wellness checks for the people, vaccines for both the people and pets, and replicating that kind of model in other communities, I think would be really, really helpful. Another example that's local to where I live is the St. Francis Pet Clinic. They are a low-income veterinary clinic in Gainesville, Florida, in my community, where they are now, or this was actually from 2017, they continue to, and this is when it was new, that they started doing outreach clinics at a healthcare clinic and social services community center in a low-income clinic in Gainesville. And so they continue to do this. It's really, really great, and it really supports the community. Okay, so future directions, unsurprisingly, longitudinal studies. Everybody says this, it's really important, right? Because we don't have causal arrows here. We can guess from our conceptual models. We think A is causing B, but we don't know until we can measure things over time, right? And so it's really important to be able to follow folks to understand what's happening with respect to, okay, maybe they have a pet and then they are delaying their veterinary care or their hospital care or whatever, or maybe they can't go get their ART after that, or maybe they have better viral suppression and therefore they get a pet, right? So there could be a reverse causality happening here that we can untangle with longitudinal studies. Intervention trials would be really, really important. I'm actually in the midst of applying for some NIH money to maybe do something like this, where we do provide some of those services, those pet-related services, and see if it helps, right? My guess is that it would, but we don't know for sure until we actually try it. Broader application to other chronic conditions, right? This is all really generalizable to, cancer, folks who need chemotherapy, right? Folks who need dialysis, anyone who needs regular interaction with the medical system and or like kind of a high care burden type of chronic disease, right? Mental health conditions, substance use, et cetera. So there's a lot of opportunity for expansion of this kind of work into other diseases. Okay, so I want to acknowledge all of my work with SHARC. They have enabled all of these studies. They've been super supportive, and Dr. Bob Cook not only inspired some of the AI skeptical dog professor, et cetera, but he's been a really amazing mentor to me and really supportive. Dr. Steve Safran at University of Miami, they are the ones that supported that third study, and then my lab, my PhD students and MPH students and my undergrad volunteers. Dr. Shelby McDonald has been a really amazing collaborator of mine for many, many years and has worked with me on all these studies, and all of my really amazing other collaborators. And then NIH funded a lot of this work through SHARC and then through CHARM. And these are my dogs in AI. AI did a great job with them, honestly. Like, it really looks like them. So that's it. Thank you very much.
Okay, do we have any questions? I will bring the mic to, oh, there we go, loud again. Anyone who has a question so you can hear online. Anyone? Are there any questions online, Jenny? Okay, great. Well, I have lots of questions. Okay. Oh, do you have one, Shannon? Yeah.
You said that the data was collected 21 to 23.
Yes.
What do you think some of the impacts of COVID were on people's responses and the barriers they were experiencing?
Yeah, I mean, absolutely. There's certainly worsened it, right? We really don't have a good comparison because we only did this work then, right? But given what we know about what happened during COVID and how veterinary care was really hard to experience, and granted that tended to, or experience to access, that mostly happened earlier on in COVID, right? And then this was 21, so things were opening back up, but COVID certainly exacerbated disparities, right? In general, in terms of care access, in terms of financial problems, housing crisis, you know, name a thing, and it got worse in terms of when we talk about those social determinants and health disparities. And so my guess is that probably this would have been not as bad. Some of those unmet needs probably wouldn't have been as stark or as high in frequency if we asked in 2019, but I just don't really know, but that would be my guess. Yeah, thanks for the question.
Thank you. Hi, Jenny. Great presentation. I love it.
Thank you.
Would you, because I know that you were mentioning that it kind of had a different impact on the Black and Latinx communities. Mm-hmm. Did you guys find that maybe looking into the Latinx communities, it was a matter of like language barriers and for some of those people, or is that something that you guys would probably look further into?
Yeah, so something I didn't mention about the Florida cohort is that they do collect the survey in Spanish, as well as Haitian Creole, which is really important in Miami. But so we certainly, it's a really good area for future research for sure. And we definitely had a lot of Spanish speaking participants that it would be really interesting to follow up with them to understand kind of what some of their unmet needs and barriers are related to in terms of, you know, if it was language barriers or other issues. But yeah, I mean, that's a really great point. We didn't specifically ask them, but it is something to consider for sure.
And then just a little follow-up. Just a little follow-up to that with like increasing political conflicts. What about things like immigration status or fear of that?
Yeah, absolutely. That would be really, really important, especially for seeking any kind of care, especially if it's you know, at a state-run health department or something, especially in Florida. You know, with and it's just honestly gotten quite a bit worse more recently with those kind of concerns. I do also wonder how that's impacting some of these issues. Certainly, it is not making it easier to maintain viral suppression, to access veterinary care, to access any kind of health care for fear of, I mean, I've heard about folks being afraid to even leave their houses, which is really horrific. And yeah, so I don't know the answer, but I can expect that it would be a really salient concern for sure.
Thank you.
Question from, oh, turned it off. Question from online. Did I turn it on? Hello, can you hear me?
Yeah.
Question from online. Thank you so much for this amazing talk. My question is, would you anticipate any differences in the benefits or challenges that PWH face related to the type of pet or pets they own, such as dogs versus exotic pets?
Yeah, yes, absolutely. And I get this question a lot. And skeptical bird professor has asked me that as well. Skeptical dog, cat. I thought I turned off for a second. Anyway, yes. So certainly, we all know that dogs require a lot more intensive care than often cats do, birds, et cetera. And so I would imagine that folks with dogs would be having the most concerns with respect to like who's going to take care of my dog during my appointments and that kind of thing. But cats also need care, birds, exotic pets, et cetera. So it's not exclusive to dog owners, but I imagine it would be kind of heightened among dog owners, probably.
I was wondering a little bit more about that zoonotic disease angle, especially when you're talking about an immunocompromised population and thinking about the intersection of access to basic vet care, like, for example, parasites or flea tick prevention. Is that an angle for sort of helping to justify some of these One Health clinics? Is that not only are you helping to care for the pet, but you might also be preventing some expensive medical interventions?
Yeah, in theory, yes. In practice, it's a little harder to say because, unfortunately, a lot of our medical system is not really focused on prevention. And I'm in a college of public health, and so we, are thinking about this all the time. And I work with folks who do One Health from a zoonotic disease prevention standpoint, and it's really, unfortunately, not a priority of the current administration, and our system isn't necessarily set up for it. However, in theory, yes, it would be a really great justification of saying, like, let's prevent an outbreak of, Giardia or whatever we want to prevent. But rabies. Rabies, great to prevent rabies. But it's not necessarily how our systems are set up. So, yeah.
Okay, well, I know we have to wrap up, but thank you so much to Dr. Applebaum.
Ruth has a question.
Yeah, Ruth is good.
It's unrelated to this.
She's waiting. She's next. Thank you so much to everyone for joining us in person and online. Sorry to those of you online who could not see the cute baby, but thanks, everyone.
Thank you so much. Really appreciate it.